I, JVN Dr. MP Sharma, Professor, Department of Physiology and Biochemistry, Faculty of Homeopathy Science, Jaipur. Today is my digital version 2.0. Topic is diuretics. Diuretics or diuretic agents are the substances which enhance the urine formation and output. These substances increases the excretion of water, sodium and chloride through urine. Diuretic agents increases the urine formation by influencing any of the process involved in the urine formation. Diuretics are commonly called water pills. General uses of the diuretics are generally used for the treatment of the disorder involving increase in the extracellular fluid volume like hypertension, CCF, congestive cardiac failure, edema. Diuretic agents prevent the hypertension, congestive cardiac failure and edema by increasing the urinary output and the reducing extracellular fluid volume. Abuse and complications of diuretics. Nowadays, diuretics are misused in order to reduce the body weight and keep the body slim. Even persons suffering from eating disorder attempt to reduce body weight by misusing the diuretics. However, prolonged use of these substances leads to complications like syndrome of diuretics dependent sodium retention characterized by edema. The adverse effect depend upon the type of diuretic agent used. Adverse effect Adverse effects of the diuretics: number 1, dehydration; second, electrolyte imbalance; third is potassium deficiency; fourth, headache; fifth, dizziness; sixth, renal damage; seventh, cardiac arrhythmia; eighth, heart palpitation. Diuretics are classified into 7 types: osmotic diuretics, diuretics which inhibits active reabsorption of electrolytes, inhibits action of the aldosterone, inhibits activity of carbonic anhydrase, glomerular filtration rate, secretion of ADH, and inhibits ADH receptor. Osmotic diuretics are the substances that induce osmotic diuretics, and it is the type of the diuretics that occurs because of the increased osmotic pressure. Some of the osmotically active substances are not reabsorbed from the renal tubules when injected in large quantity of into the body. These substances increases in the osmotic pressure in the tubular fluid. Increased osmotic pressure in the tubular fluid in turn reduces water reabsorption. It leads to excretion of the excess of water through urine. Elevated blood sugar level in the diabetes can also cause osmotic diuresis in the same manner. Example: urea, mannitol, sucrose, glucose. Diuretics of this type inhibits the active reabsorption of the electrolytes like sodium and potassium from the renal tubular fluid. Inhibit of electrolytes reabsorption cause osmotic diuresis. And these diuretics agents are three types: loop diuretics which inhibit the electrolytes reabsorption in thick ascending limb of the Henle. Loop diuretics are the substances that inhibit electrolyte reabsorption in Henle loop. These diuretics inhibit the sodium chloride reabsorption from the thick ascending limb of the Henle loop, so the osmotic pressure in tubular fluid increases, leading to diuretics, and the osmolarity of the medullary interstitial fluid also decreases due to the inhibition of the sodium reabsorption into medullary interstitium. So the medullary interstitium fails, the concentration of the urine resulting the diuretics which inhibits the transport electrolytes from diuretics of this type of the inhibits sodium reabsorption proximal part of the distal convoluted tubules, and these diuretics are usually called thiazide and related diuretics. Example: furosemide, toracimide, bumetanide. Diuretics which inhibit active transport of the electrolytes in the distal part of the distal convoluted tubules and collecting duct. Some of the diuretics inhibits reabsorption of the sodium and excretion of the potassium in distal portion of the distal convoluted tubules and convoluted collecting duct. Such substances are called potassium retaining diuretics or potassium sparing diuretics. Example: trimetrine, amyloride. Diuretics which inhibits action in the aldosterone. Some diuretics inhibit sodium reabsorption, potassium reacceleration, distal convoluted tubules and collecting duct, and inhibits the action on the aldosterone. And these substances are also called the treating potassium retaining diuretics or aldosterone antagonosis. Example: spironolactone and epinephrine. Namaste. Hope you are all satisfied with my version 2.0 session diuretics. If you have any query, please mention in the comment box, so we will have the problem solving live session. Thank you.